Welcome back to the Our Invite podcast. My name is Nima,
My name is Aaron.
and today we're joined by a very special guest, facial plastic surgeon Dr. Madnani from New York. Thank you so much for joining us.
Thanks for having me.
So we really appreciate you taking time out to come speak with us. I'm here to tell our viewers and listeners a little bit about yourself.
I'm a facial plastic surgeon. I'm based out here in New York. I have practices in New York City and Long Island, and we're expanding to a few other places on Long Island. Facial plastics, so I do 100% cosmetics, which primarily facelifts, eyelids. We have a large injectable practice. We do a lot of skincare with lasers, resurfacing, thread lifts. I have extenders that work with me, physician assistants, nurses, and nurse practitioners. So we have a lot going on. And outside of that, I hold a academic appointment at the Albert Einstein College of Medicine, is where I went to medical school. So I'm a clinical assistant professor there. So I do volunteer call at Jacobi Medical Center, which is the trauma hospital in the Bronx. And but once, I think 3 or 4 nights a month, I volunteer there. And then I also, I guess part of my work or extension of my work is I volunteer my time with a group called Operation International, where we do volunteer surgeries around the world.
So what is the biggest myth that comes with a plastic surgeon?
I guess that, you come in with a picture of what you want and they can, hey, yeah, we can make you look like this,
Yeah.
That's the biggest one. So I guess expectations have to be met. And I know lots of these cartoons and memes out there, right? I've had plastic surgery. There's a rubber duck talking to like a real duck. Hey, he must have had plastic surgery. So those are all like the biggest myths, but yeah.
Okay.
So at Madnani Facial Plastics, what is the most requested procedure, and why do you think that's the case?
Well, for me, it's facelifts. Like that's my focus. So that's what I focus my training, and that's my favorite procedure to do, and that's what I am known for at this point. So on the surgical side, it's usually facial rejuvenation surgeries, which includes facelifts, and then the other side is we do a lot of non-invasive injectables. So between the surgical facelifts and the injectables, we're very busy.
So when the average person thinks plastic surgery, you hear that, you think Los Angeles, you think New York, you might even think Miami. How important is location, and how important was location for you when you wanted to open your practice?
Location, I guess you're right, it's important, but I think you can be busy anywhere at this point with social media out there. You can market yourself. Once people know you're there and they know you're good, they'll come to you, and people are looking for these services all over the place. It's not just in these markets. I think these markets are the most concentration. You're the most doctors in these markets too, and the highest density population. And then, all the quote unquote celebrities are in these markets too.
Yeah.
So people see them get work done and they're like, oh, they must have gone someone there. And that's how it goes. But my colleagues all over the country are pretty busy doing what we do.
So your practice has extremely favorable reviews, and it seems all your patients seem to leave satisfied. So what is the secret to have consistent, high-quality care?
It's a lot of work from soup to nuts. So from when they call in and they speak to somebody on the phone to when they leave for the services. My team is an extension of me. So I do work, but they do more of the work than I do. And, a patient has to get through almost like 20 people before they come and see me. So each of those 20 people really have to provide the excellence in patient care that we strive for. So I think it just boils down to the bottom line is patient care. So no matter what the question is, or whenever there's a question about what do we do, bottom line is, in the back of your mind, our ethos is how do you provide the best care? When you have that in the back of your mind, you kind of answer all your questions. So I think if you focus on that, whether it's cleanliness in the office, whether it's providing a nice atmosphere, whether it's going the extra mile, giving ice packs or numbing cream for injections, whether it's For me, it's about going the extra mile, and patients really appreciate that. You know, for me, being dressed up at work, for me, it's showing appreciation for my patients. All those things for me are important.
So you mentioned social media and on the last question, and I know I actually found you through TikTok. Like, it came across. You're very active on TikTok. You're active on Instagram. How important is that? How has that affected your practice? And what's your advice to future or current physicians that are not so much involved in social media? You know, they're still old school.
I think with any business right now, if you're not on social media, you don't really exist. And with all of these platforms right now, especially with what I do, there's so much information there's so much misinformation out there.
Yes.
And even posting one or two little posts on something as simple as Botox for what I do or injectable is like, wow, we didn't know this. Or like the feedback for me, the feedback's amazing is when patients comment, you know, it's so nice that you demystify the process. You know, for me, it's about demystifying the process. I mean, I'm having some car trouble now, so I've taken my car now to the garage 3 times to get repaired. And every time I leave, it's the same issue, but I'm spending money, and they're telling me what they're doing, right?
Yeah.
But I have no idea what's going on behind the scenes. So for me, it's just demystifying the process. I've been on both sides of the healthcare system, patient and doctor wise, and you know, when I think when a patient's informed, it's they make better choices, better decisions. For me, it's fun. I love to show what I do. I love to talk about what I do, and the feedback is immediate. You know, we love getting the education. We didn't know this is what could be done, and it's nice to see what happens behind the scenes.
When you started on TikTok, did you think it was going to become what it has become and done for you?
We've only been doing it for a couple months, to be honest.
You guys started pretty early.
We started just before COVID.
Yeah.
We started around that time. And before that, we were just figuring it out because I was having my team. I had my team start. I'm like, I opened the account. I started figuring it out. I couldn't figure it out. And I'm like, just do some of that stuff. And I wasn't going to do all the dancing stuff. I refused to do that. Not that I have, and there's no disrespect for the dances, but that's just not my brand, or that's just not me. Like, I want it to be natural and flowing. For me, it's nice to talk about what I do. And then, but there are people on there who just kind of talk about what they're doing, and they still get likes and follows. And so there is a segment of the population looking for education. And I think the format's really nice in terms of the 15, 60-second formats. And I think it's what they say, it's an artist community out there. But I think everyone who does what they do and they love are essentially artists. So you're showing your craft, and I'm showing my craft, which is why I think a couple of videos I didn't think would do well have done well. So that kind of leads you down a rabbit hole of where to focus your energies.
Perfect. Yeah.
So what is the ultimate goal for yourself and your practice?
The goals move. So for me, it's just about having fun at work and trying to grow the practice. We started 2 other locations just last week and next month. So for me, it's just about growth. It's about being better next year than I was this year, last month. I'm not sure what my end point is. I'm not really sure what my goal is that way. I do know that I want to do something that hasn't been done before in our field. And what that is, I'm just pushing the boundaries of what that is on a daily basis, because it's kind of fun to experiment.
So you spoke about trust with your patients. You know, they bring in a picture, they're like, I want to look like this. And you then trusting in you too, that you're going to be able to do that. What's your advice to upcoming plastic surgeons and, you know, to be able to build that trust? I'm sure that didn't happen overnight. You had to be multiple procedures for you to get there.
Right. So I think the trust factor, I think it's just being ethical and being honest with everyone, and people pick up on that, you know, whether it's through your work or when you meet people. I think those 2 things are very important, being available for your patients, being trustworthy, and being ethical. And I think things and obviously doing good work, you know, and that comes with practice. So I think that's just for in any field. I think as long as you're honest about what you do and you end up being good at what you do. But how do you get good at what you do? You work really hard and you put a lot of hours in, and that's kind of where it goes with anybody.
Of course, there's competition out there. That's natural. You need that to keep you on your toes. What do you think you in your practice does very well that sets you apart from the competition?
I think for us, we're almost like a one-stop location for everything on the face. You know, a lot of people will only focus on whether it's just surgery or just non-invasive or just laser or just skincare. Like for my patients, for them, it's great that, you know, they can get their facelifts done and then they can come here for their skincare afterwards, or for their products, or for their injectables. Like for them, it's a nice added service for them. So in that respect, we provide a variety of services that patients can benefit from. We have multiple locations, so geographically, especially a place like New York, people spend time in Manhattan and Long Island, and they kind of spread out too. They can kind of pick and choose locations, so availability that way. Accessibility is there. A lot of doctors have one location. We're building a nice team. We're at 4 locations now. So I think the accessibility is there. And also me being super specialized, I'm not doing everything. I'm focusing on your mug. You know, I focus on your face. My other tagline is, as long as you have a face, I can do something for you, right? So
you need to help us.
So as long as you have a face, I can do something for you. So what that is, I'm super specialized in that, and I want to be a resource. So we have a lot of information online, whether it's hours and hours of content on YouTube or Instagram or Facebook or IGTV or TikTok. We have so much content out there, and it's pretty consistent across the board. So I think that's what we do different versus everybody else.
So as a physician and being able to open multiple offices, you obviously have to be business oriented. How important is it to have that business oriented physician to be able to be successful? Is that important? Do you not need to be? Can you still manage?
But you learn that as you go, or you have to educate yourself, because that's not something you're going to learn. I guess it's an entrepreneurial instinct, but if you have it, you still have to feed it and educate it. So I do a lot of work on the sidelines, whether it's conferences or whether it's getting consultants or whether it's reading. But you have to learn that. You know, you have to learn the accounts. You have to learn the cash flow. You have to learn strategic planning. You have to learn, you know, it's hiring, firing, building a good team around you. But I think it's about being able to build a good team, but you start with 1 person, 2 people, and you kind of grow from there. But you know what, I have to charge my computer. Let me charge my computer, otherwise it's going to go.
Yeah, no problem.
But I think it's about building a good team around you that can help you with this. And you have to know what your weaknesses are. And that's what it's like, being honest with yourself. And then you have to hire your weaknesses and build upon your strengths. Those are that's what's key in terms of, I guess, going to your question. But yes, and that's not for everybody. It's a lot of work. For me, it's fun, but it's a lot of work. I would be, you know, there are obviously times where I'm like, hey, having one office, you know, having 3 people work for you and, you know, calling it a day after, you know, working 4-day work week would be awesome. But maybe I'll do that when I'm, you know, in 20 years from now.
Yeah.
But I think it's something, I think you'd asked me earlier, what's my goal? My goal is just to push the envelope, and I'm pushing the envelope. I think I'm doing it in a controlled manner, but pushing the envelope and doing things that haven't really been done. But being an entrepreneur and a physician is a cool skill set to work on.
For sure.
It's a rare skill set to have, but it's something that I'm working on. I'm enjoying the journey of it all. So
yeah, that's what sets you apart from the others.
I think that's one of the differences. Yeah.
So obviously, with our healthcare climate, you're gonna have, any business has to make a lot of changes. So how do you think virtual consultations have changed the way you will be doing business moving forward?
So I think it's been great. So I think it's a great question, and whether it's my business or anybody's business, whether it's your businesses too. I mean, the industry or the world in general has. I forgot what the word is, but we've shifted, or we've accelerated the acceptance of technology over the past 9 months, right? It's been amazing. So I think those that have adapted. So I've heard 2 things with, especially, I mean, physicians on the border of retiring have retired. They're like, I don't want to deal with this, right? If I can retire, I don't want to deal with this. you know. And then the super young guys are like, they're easy for them. The technology is easy,
Yeah.
right? But then they don't have the skill set or the credibility or the patient base. I'm
True.
like I'm the quote unquote gray zone, right? I have the credibility. I've been doing this for 15 years, but I'm also I feel savvy enough to pivot and accept the technology and incorporate that ASAP. So, you know, we're seeing we're doing the same, you know, we're doing the same revenues as we were before COVID, but I'm seeing fewer patients. Now, why is that? Because we're working smarter because of technology, right? So all of the patients coming in for routine follow-ups that didn't really have to come in, we're doing them via Zoom. Patients are happy, it's convenient. We're doing all consults via Zoom, whether it's international patients or whether it's local patients. And they come in and just when they want to do, they come in for procedures. So we're saving everybody's time that way too. So I think it's been great. It's been, I tell my colleagues, you have to pivot. And this is a great pivot point where you either you sink or swim, and people are swimming slowly.
I've read someone that you mentioned before that you don't perform procedures using general anesthesia. Can you explain what that means? You know, that might scare a patient at first, be like, oh, it's going to hurt. What's going to happen?
Yeah.
Explain why you are doing that.
So it's another reason why we educate a lot on our social media is that we show surgeries live. We go live on our surgeries a lot, whether it's under local anesthesia or IV sedation. We show like full facelifts, we show neck lifts, we show eyelids to show that it can be done, because people have this perception that if you're having surgery, you have to be put out. There are a whole host of other risks associated with general anesthesia that I don't want to deal with. I don't have to bother. I feel it affects your recovery. I feel patients heal quicker. I'm pretty fast at what I do as well. So, you know, it doesn't take me 6 hours for a facelift. We can do it in 2 hours. So those are all things that people need to be educated about, because a lot of, it's not misinformation, it's old information. So there's newer ways of doing things. And when you tell people there are newer ways to do things, they're like, oh, wow, great. I was so afraid because I don't want anesthesia. I don't want to go under. Now I know I can do it in the local. That's awesome. You know, we offer both ways, but there's a huge subset of the population that doesn't want to deal with anesthesia.
Yeah, for sure.
So if you were to get any procedures done on yourself, what would it be?
I do a little Botox. I do some skincare, lucky that way. I'm sure age will catch up to me too, but I'm following all the precautions between the Botox and the skincare. I think I'm holding it off. Would I do anything else? Yeah, we have some non-invasive skin tightening treatments I would do, but it's also on the inside. You know, you got to eat well, you got to be healthy, work out. But yeah, those are things that I would definitely do. I wouldn't be opposed to having anything surgery when it gets there, but I'm going to be like my other patients. When you hit a point where it's like, I can't stand it anymore, then you do it. And then we have a subset of patients that are like, listen, my mom had her facelift, my aunt had her facelift. I know what's going to happen. I want it now because I know what's going to happen. Sure, you know, as long as you're a candidate, we can do it. It used to be such a taboo subject. I think it's just in our generation right now that everyone's talking about it, and it's kind of mainstream. I mean, I'm sure your parents' generation even is borderline taboo. I did my mom's facelift, you know, a couple of years ago. She would never have done it unless I was a plastic surgeon. She would never have done it. And then, you know, all her friends are like, wow, you know, but I would never do it. And then you have, you know, it's also very cultural. In Asia, it's open. It's not so open, but everyone does it. No one talks about it. South America, everyone does it. It's a rite of passage. In India, it's everyone does it. No one talks about it. You know, and over here, everyone does it. Everyone talks about it. It's so cultural also, which is great. Which is also another great thing about why I love being on social media. Is because, you know, I'm born and raised in Hong Kong, so I grew up in Asia. My parents are from India. I spent a lot of time in India. I lived in Europe for 6 years, so I went to boarding school. Then I've been here, so I've kind of lived all over the world. So I have friends and family everywhere, and so for me to be able to you know, break through different cultures, understand different cultures, put my work out there is also great, which is why I like to educate a lot, because it just hits people in different places in different ways.
So you're obviously very much of a leader. You said patients got to go through 20 people to get to you. So you're the leader of your practice. How has your leadership skills changed over the years from medical school to now?
Well, I think they're a little better now, but they're a little better because you have to grow with what you're doing. But the leaders, Yeah, I think I'm less arrogant and more willing to listen at this point, and also more willing to let go. Especially, you can only grow so much if you're gonna micromanage everything. So letting go has been a big aspect of bringing good people on board and letting them run with stuff too, and trusting the process. So I'm a little more trustworthy of the process, and if shit hits the fan, shit hits the fan. It's not always the end of the world. You have to make mistakes, and it's not the end of the world. So I think I'm more accepting of my mistakes, especially. So that way, I think I'm more mature that way.
If you can do anything different throughout your medical school career or in your life, what would it be?
I would have done, so focused on getting into med school. That was my 100% focus till I was about 30, I think. Then after residency, you're like, wow, that's not it. You have to, basically after residency is when kind of life starts, and you kind of have to learn figure out which kind of practice you want to do, either run your own practice, work for someone else, figure out the patient care, so I think the first 30 years is just getting all the qualifications, but then all the learning starts after that. I mean, everything I do now, I did not learn before. So I think I would have expanded my horizons, whether I would, like, all my free time I spent doing research or learning, doing microvascular surgery on rats, or doing research, or just super focused on getting into medical school. But I think expanding my skill sets, I would have probably focused on that. Maybe work, as opposed to doing research or working in hospitals, maybe, I don't know, work in finance for 6 months, 3 months, or, go just do something totally unrelated to what I'm focused on. Because I think the more skills you get, especially now, the more skills you get, you can kind of tie everything in at this point later on. So that's I would that's my advice, especially people in residency or in medical school. What do I do? I make try something else for a bit, but don't give up focus on what you want to do. Just expand your exposure.
Option, yeah.
So you mentioned that most of the things you did learn happened to be after school. So how important is it to be flexible and be able to learn on the fly?
Yeah, it's super important, right? And we didn't have YouTube and all that stuff. Or it was all coming out right when I was getting started. But yeah, I mean, what's the great thing now is that there's no excuse. There's no excuse for anyone saying I don't know or how do I, because in 3 seconds you know how to do it, right? Yeah. So that's I think being open-minded and being able to do that. I mean, even with my daughter, with my kids, with my daughter. She's always like, how do we do this? I'm like, figure it out.
Figure it out.
We'll look it up and we do it. And then we're like, okay, and we do it. But for her, it's normal at this point, right?
Okay.
Yeah.
I don't have to explain that. How do we trade stocks? What's a stock? Well, here, let's look it up.
Yeah.
I know now what that is, right? So you can find out in 2 seconds. So yeah, I think just being open-minded is super important.
You said your parents are from India. You were born in Hong Kong. I was born in Iran. So that culture is always like, either you're going to go to medical school, law school, or engineer. Did you always want to be going to medical school?
Yeah, I always wanted. Hold on. I always wanted to be a doctor, but I come from a family of just business people. So I'm the first doctor in the family. But obviously, yeah, when you're a kid and you say you want a doctor, especially if you have an Indian parents, they encourage you all the way, right? But yeah, I've always wanted to be since I was a kid. So I don't know why. I just want to help people. That was my reason I want to help people. So
what made you choose plastic surgery over the other specialties?
So my specialty is I'm a head and neck surgeon. So I'm an otolaryngology head and neck surgeon. So I'm an ENT head and neck surgery. A subspecialty of ENT is facial plastics. So when I first started working, I was a foreign student here, so I didn't have a green card. So to practice in New York, to get a medical license and practice independently, you have to have a green card or be a citizen. So as a foreign student, I couldn't get my medical license independently in New York. So unless I worked for a hospital system, which I didn't want to do. Mm-hmm. So I moved to New Mexico. I had a British passport then. So I moved to New Mexico and I worked for the hospital. But after about 6-7 months, I got my green card. but I was the only head and neck surgeon there in my corner of the state. So I opened up my own private practice. And then we got busy, opened up another practice. But when I was there, I did everything. I did cosmetics, I did reconstructive, I did head and neck surgery, I did thyroids, I did pediatrics, I did sinuses. We did everything. We did allergies. I did everything I was trained to do. But then after I had my first child was born, did a lot of health issues, so we had to move back to New York. So we closed up the practice. I closed up my practice within like a month. Moved back here with no job, but luckily for some reason I still had my license on standby here, so I got it really quickly when I moved back here. So when I moved back here, I had I took a month off just to get my daughter settled in all the healthcare, and I took my time figuring out what I wanted to do, but I had a few requirements. I didn't want to deal with any insurance, and I didn't want to deal with the hospital. Mm-hmm. And I've always been pretty artistic on my own, and I love cosmetics, so I started doing just facial plastics. I had dermatology colleagues that needed help with reconstructive surgeries and stuff. I had other ENT colleagues that needed help covering their practices. So I did a lot of part-time gigs. I worked like 6 different offices. I had the flexibility to my schedule, at least that way. And I kind of built it out from there, and the cosmetics really took off. I got my certifications and all that in New York. So yeah, I like the flexibility. I love the artistry of it. I get to do a lot of surgery still. I think we're on the cutting edge of a lot of what we do, which is great. So that's why I love it. So it's just great. And then I get to do all the other reconstructive stuff on my medical mission. So it's not like I don't get to do any of the other stuff I trained. And then I also volunteer call at the teaching hospital. So we do a lot of the trauma and that kind of stuff there too. So I got my fingers in everything, but my bread and butter is my cosmetics practice.
Of course, yes.
So you mentioned that you like to push the envelope. So what are you looking to bring to your practice that you already haven't been doing?
I mean, we do hair transplants, which is a beautiful procedure, especially for
men. Can you help us up with that?
Yeah, I might need to.
I got you. So hair transplants are great. I mean, it's very artistic. We're combining procedures, whether it's lasers with injectables. A lot of my surgical patients get lasers after. Like, there's a lot of technology you can combine doing what we do. I'm trying out the multiple locations thing with practices with me being a facial plastics. I have some physician extenders working with me, trying to expand our footprint, doing a lot of education on social media. So I think that way we're kind of pushing the envelope. Surgeries wise, we're doing the facelifts under local anesthesia. That's not commonly done.
Yeah.
So I think those are all things we're working on.
Are you looking to expand outside of New York?
I'd love to, yeah, which is another reason why social media is super helpful for that,
Yeah.
You expand your brand in other places. Yeah, I'd love to. America's a big place.
Hey, if you need a pharmacist in Miami, we're here for you.
I was going to say I left Miami, California, but I'd love to be in Miami, yeah.
What is the hardest decision that you've had to make in your professional career?
Hardest decision, I think. I wasn't really professional work-wise. For me, I always have. I'm always trying different things out, and whatever works, I go that way. So that way, work-wise, it's not really. I mean, it's stressful sometimes especially when things don't go right. But then part of growing and being a leader is managing that stress, because it's not really stress; it's just growing pains. If you look at it that way, I don't think nothing's really so stressful. I think being patient is extremely difficult. Waiting. I mean, you guys have a long road ahead of you guys too, right? But you guys have put in a lot of hours, a lot of time, a lot of blood, sweat, and tears into your careers, and you guys haven't even started yet, right? So I mean, patience is all I can say. Having a little vision. Finding mentors and having patience. But hardest decisions, I mean, for me, it's more personal stuff. Like, things happen, leaving your Mexico children, all that kind of stuff. But I think work-wise, I've been touched with lucky. I've never been scared to put in the work. It's just having patience and being optimistic is just or learn skill sets.
When you're not making people look great, what do you like to do in your free time, if you even have that?
Free time I have with my kids. I work out. I meet friends out. New York is an easy place. Everything's kind of just right there. You go out, cook the thing, meals, but it's mostly I do a lot of reading. I do a lot of self-education, but I travel a ton. I was at the point where at least once a month or once every 2 months, whether it's a little weekend break in Miami or whether it's a medical mission or my parents are also all over the place. So my parents are in Hong Kong or India. I have family in Dubai, so we travel a lot. So it's a lot of vacations, a lot of travel time. But yeah, it's nothing extraordinary there.
If you remind me, let us know.
Will do.
Do you have a relationship with a pharmacist? And I'm not sure, as a plastic surgeon, how much do you interact with the pharmacist? I know you said you're at the hospital also. What's your relationship with the pharmacist?
Nothing much. I prescribe medications for my patients. That's about it. And then there's one topical hair medication that we prescribe. It's compounded at specialty pharmacy. Otherwise, I don't really have any relationship with pharmacies that way. There's a lot of great stuff going on in your field, man. Private equity and tech people are all over your field.
Yeah. If we were to go back to high school or not high school, undergrad or medical school, and we were to ask your best buddy or your professors, who is Dr. Madnani, what would they say?
Yeah. That's a bit of a troublemaker, I think. I was out for a good time, I think. I think I had more fun in med school than I did in college, if that means.
Okay.
Yeah, I think that's what they say. The guy's a good guy, could probably work a little harder, not too focused.
Well, you're working hard now, so.
Not too focused, but yeah. But when you know what you want to do, you go for it, Yeah.
So any upcoming plastic surgeons, what advice do you have for them?
I think for me or for us, my field or your field, I think just whatever you do, you really have to love what you got to do, but there's no shortcut to putting in the work, and that's I think the key, especially with what I do. There's no shortcut to putting in the work, but finding people you admire or you want to be like and trying to get close to them, I think that's also another great piece of advice, which I wish I did. That's one thing I didn't do enough of.
Okay.
So I want to put you on the spot right now because you're obviously very hard to get in touch with. So what if someone wanted to get in touch with you and do that with yourself? Is there any way they can get in touch with you? Do you provide that opportunity?
Yeah, we do. We have people come rotate here. We have people. I work with med students. I work with residents. Because
I feel like students are always like scared to reach out. They're like, oh, he's very busy. He has a lot going on.
That's on them, right? You got to cold call.
Honestly.
Exactly.
You cold call, and that's part of the hustle, right? So if you're scared to call me, then maybe we're probably not a good fit.
Yeah, exactly.
So that weeds itself out, but it's part of the hustle, and it's if I can't help you now, we can work with each other later. Like, yeah, our doors are open, people can watch, but that's why we're also all over social media. Like we go live on surgeries, and we answer questions, or my team answers questions. Like there's a lot of transparency in what we do. But a lot of the nitty gritty is just work behind the scenes, and that's just Well, you can't really teach that. You can guide, you can't really teach it.
And do you think any of your upbringing had to do with how hard you hustle and how hard you work?
Well, yeah, I see my dad. My dad was in. Typical immigrant story. Don't pull out any violins here, but he grew up in India. He went to Hong Kong when he was 18. It was a British colony back then to look for work. I think he worked with his aunt or uncle or something. But he came to Hong Kong with The Rock likes to talk about this $7 he had in his pocket. My dad had like $20, nothing. Yeah. We built like this global business empire, but that was a lot of work. But and then looking, but you have your ups and downs, right? So I think that definitely has a lot to do with it. You see that. My mom spent a lot of time with us too, but a lot of that is upbringing is part of it, but I think a lot of it's also internal drive, I was lucky early on to know what I wanted to do. So that's a good thing. And then back then, when you didn't know what you want to do, it was like, oh my God. But now it's not so bad when you don't know what you want to do, because you can still try things out, right? But I was lucky early on to know what I wanted from the beginning. So it was easy. Everything I did was trying to become a doctor. So every decision I made was that. I had a lot of uncertainty, a lot of easy decisions to make.
Perfect.
Relatively speaking.
Yeah. Well, I know you're busy and you have to go places. So we want to thank you for taking the time to sit down with us. We're definitely going to be looking for your practice to be opening up in Miami. We'll be the first ones lined up outside for the ribbon cutting.
And a hair transplant.
And a hair transplant.
Awesome. Well, listen, pleasure talking to you guys, okay? Thanks for taking the time to have me on as well.
Of course. And thank you for everyone that tuned in. My name is Nima.
My name is Aaron.
And thank you for accepting our invite.